There is a version of Sjogren's disease that almost nobody is talking about. It does not start with dry eyes. It does not start with dry mouth. It starts with a fever, or a shot in your arm, and then months later your body never goes back to normal. If you got sick with COVID in the last few years, or you got vaccinated, and something in you has felt subtly wrong ever since, this video might be the missing piece nobody has given you. I want you to picture something most people never think about. Your immune system has a memory. It is trained to recognize invaders, remember them, and attack them faster the next time. That is how it protects you. But every once in a while, that memory system makes a mistake. It sees a piece of a virus that looks almost identical to a piece of your own body, and once it learns to attack that virus, it never fully unlearns the attack. Sometimes it keeps attacking your own tissue long after the virus is gone. That mistake has a name. It is called molecular mimicry, and researchers now believe it may be one of the reasons Sjogren's disease is showing up in people after COVID infection and after COVID vaccination at rates that were not expected. Before we go further, I want to be completely honest with you about what is established and what is still being investigated, because you deserve that honesty. Here is what we actually know. Viral infections have been linked to the onset of autoimmune disease for decades, long before COVID ever existed. Epstein-Barr virus, in particular, has been studied for years as a possible trigger for lupus, rheumatoid arthritis, and Sjogren's disease. We also know that COVID infection itself has been documented to trigger new autoimmune disease in some patients, including cases of new-onset Sjogren's. And we know that a small number of case reports and observational studies describe new autoimmune symptoms appearing after COVID vaccination as well. Here is what is still being investigated. Whether the vaccine itself can directly trigger Sjogren's disease in a person who was not already predisposed. How much of a role genetic susceptibility plays. Whether reactivation of dormant viruses like Epstein-Barr is the actual mechanism connecting all of this together. And why some people develop lasting symptoms while the vast majority of people who get COVID or get vaccinated never develop anything at all. I am not here to tell you the vaccine or the virus definitely caused your symptoms. I am here to walk you through what the research actually shows, so you can bring real information to your own doctor instead of guessing in the dark. Let me tell you about a woman I am going to call Mara, because her story is a composite of a pattern that shows up again and again in people describing post-COVID and post-vaccine autoimmune symptoms. Mara was 31. She ran 3 times a week. She had never had a health problem serious enough to miss more than a day of work. She got COVID in the winter, a mild case, the kind she assumed she would forget about in 2 weeks. She did not forget about it. 3 months later her eyes started to feel like there was sand under her eyelids every single morning. She thought it was allergies. Then her mouth started to feel dry at night, dry enough that she woke up needing water 2 or 3 times. She thought it was the heater running too much. Then her joints started to ache in a way that felt different from soreness after a run. It moved. 1 week her fingers hurt. The next week it was her knees. She went to her primary doctor, who ran basic blood work and told her everything looked normal. She went to a second doctor. Normal again. By the time she found a rheumatologist willing to run a full antibody panel, 14 months had passed since her infection, and by then the dryness had become so severe she could not eat crackers without water nearby. That 14-month gap is not rare. It is closer to the average. And it is exactly the gap I want to help you close today. So let's talk about what Sjogren's disease actually is, because if you have never heard the word before, everything else in this video will make more sense once you understand this piece. Sjogren's disease is an autoimmune condition where your immune system attacks the glands in your body responsible for producing moisture. Most people know it by its 2 most famous symptoms, dry eyes and dry mouth, because the immune system is primarily attacking the tear glands and the salivary glands. But here is what almost nobody tells you when you first get diagnosed. Sjogren's is not just a dryness disease. It is a whole body disease that can affect your nerves, your joints, your skin, your gut, your lungs, your kidneys, and in a small percentage of cases, it raises the long-term risk of a specific type of lymphoma. The dryness is often just the visible tip of something much bigger happening underneath. Now let's go through the signs, because I want you to be able to check these against your own body while you watch this, especially if COVID or a vaccine came before any of this started for you. Sign number 1. Morning eye irritation that feels like grit or sand, especially noticeable the moment you wake up, that improves slightly as the day goes on but never fully disappears. Sign number 2. Blurry vision that comes and goes, particularly after reading, screen time, or being in air conditioning or wind, caused by an unstable tear film rather than a change in your prescription. Sign number 3. A dry mouth that is worse than normal thirst, where you find yourself needing water to swallow dry foods like crackers or bread, or waking at night specifically because your mouth is dry. Sign number 4. A sudden increase in dental problems, particularly cavities showing up in places you have never had them before, because saliva is what protects your teeth, and when it disappears, decay accelerates quickly. Sign number 5. A hoarse or raspy voice, or a persistent dry cough, because the mucous membranes lining your throat and airways can dry out the same way your eyes and mouth do. Sign number 6. Joint pain that migrates, meaning it shows up in one joint for a while and then moves to another, often symmetrical, often worse in the morning, and often mistaken for regular arthritis or overuse. Sign number 7. Fatigue that sleep does not fix. Not tiredness after a long day. A bone-deep exhaustion that is present even after 8 or 9 hours of sleep, and that can hit suddenly in the middle of the afternoon like a wall. Sign number 8. Numbness, tingling, or burning sensations in the hands and feet, which happens when the immune attack starts affecting small nerve fibers, something researchers refer to as small fiber neuropathy, and it is far more common in Sjogrens than most people realize. Sign number 9. Brain fog, meaning difficulty finding words, forgetting things mid-sentence, or feeling like you are thinking through fog, which many patients describe as one of the most frightening symptoms because it feels like something is wrong with their mind rather than their body. Sign number 10. Dry, itchy skin that does not respond to normal lotion, or unusual rashes, particularly on skin that has been exposed to sunlight. Sign number 11. Digestive issues including acid reflux, difficulty swallowing dry foods, bloating, or changes in bowel habits, because the dryness and inflammation can extend down into the digestive tract. Sign number 12. Vaginal dryness in women, which is frequently dismissed as a hormonal issue or attributed to age, when it may actually be part of the same glandular attack happening everywhere else in the body. Sign number 13. Swollen salivary glands, particularly the glands along your jawline near your ears, which can swell and then go back down, sometimes mistaken for mumps or a passing infection. Sign number 14. A persistent low-grade fever or feeling like you are constantly fighting something off, without ever actually getting sick, because your immune system is in a chronic state of activation. If you counted 4 or more of those and you are watching this because you had COVID or got vaccinated in the past 2 years and nothing has felt fully right since, I want you to comment the word signs below this video, because I am going to be replying with more specific information based on what people share, and I want to know how many of you are seeing this exact pattern. Now let's go into the research itself, because I promised you this would be science-backed and I intend to keep that promise. There is a growing body of case reports in journals covering autoimmunity describing new-onset Sjogren's disease following COVID vaccination. These are documented cases, published, peer-reviewed, where a person with no prior autoimmune history developed clear diagnostic markers of Sjogren's, including the specific antibodies doctors test for, within weeks to months of vaccination. Separately, there is research describing new-onset Sjogren's following COVID infection itself, which lines up with decades of prior research connecting other viral infections to Sjogren's onset. There is also a preprint study, meaning it has been submitted for review but not yet fully published, out of a major research university, looking at something researchers are calling post-vaccine syndrome. In that research, they found elevated markers connected to Epstein-Barr virus reactivation in people reporting persistent symptoms after vaccination. Epstein-Barr virus is something over 90% of adults are already carrying in a dormant state, kept asleep by a healthy immune system. The theory being investigated is that certain immune triggers, whether from infection or vaccination, may in some people disrupt that dormancy, wake the virus back up, and in doing so trigger a cascade of immune confusion that lands on autoimmune disease in genetically susceptible individuals. That same research has documented symptoms including fatigue, numbness, brain fog, neuropathy, insomnia, heart palpitations, muscle pain, ringing in the ears, headaches, burning sensations, and dizziness, which is strikingly similar to what many Sjogren's patients describe, especially in the early phase before the classic dryness becomes obvious. I want to pause here and be very clear about something because this matters more than almost anything else in this video. Long COVID is now formally recognized by health officials. There are diagnostic codes for it, research funding for it, and increasing physician awareness of it. Post-vaccine syndrome does not have that same recognition yet. Researchers studying it have specifically noted that this lack of recognition means many patients describing these symptoms after vaccination are being dismissed, told it is anxiety, told it is unrelated, or sent from specialist to specialist with no one connecting the dots. That does not mean every unexplained symptom after vaccination is Sjogren's disease. It means the medical system currently has a blind spot, and if you are someone living inside that blind spot, you deserve to know it exists so you can advocate for yourself. So why does this get missed for so long? There are real reasons, and understanding them will help you if you are trying to get answers. Reason 1. The standard blood tests doctors run first, the basic panels, often come back completely normal in early Sjogren's, because the specific antibodies associated with Sjogren's are not part of a routine blood panel and have to be specifically requested. Reason 2. Symptoms fluctuate. A patient can have a genuinely dry mouth one week and feel almost normal the next, which makes doctors, and patients themselves, doubt what they are experiencing. Reason 3. Dryness is something almost everyone experiences occasionally, so mild early symptoms get written off as normal aging, dehydration, allergies, or side effects of unrelated medications. Reason 4. Sjogren's is more common in women, and there is a well-documented pattern in medicine where women's symptoms, especially fatigue and pain, are more likely to be attributed to stress or anxiety before physical causes are investigated. Reason 5. Most primary care doctors see Sjogren's rarely enough that it is not the first thing that comes to mind, and by the time a patient reaches a rheumatologist who specializes in exactly this, months or years have often already passed. Now I want to talk about why untreated or undiagnosed Sjogren's matters beyond just discomfort, because this is the part that made me want to make this video in the first place. When Sjogren's goes unmanaged for years, the chronic inflammation does not stay contained to the eyes and mouth. In a small but real percentage of patients, that ongoing immune activation increases the long-term risk of developing a type of lymphoma called mucosa-associated lymphoid tissue lymphoma, often referred to by its abbreviation. This is not meant to frighten you into thinking every case of dry eyes leads to cancer, because it absolutely does not. The overall risk remains low. But it is exactly why early diagnosis and ongoing monitoring matter, because catching this early and managing the underlying immune activity is part of what keeps that long-term risk as low as possible. Beyond that, unmanaged Sjogren's has also been associated with lung involvement, kidney involvement in a subset of patients, and increased cardiovascular risk over time, because chronic systemic inflammation affects far more than the glands where symptoms first appear. I know some of you watching this are thinking about a specific event in your own life right now. Maybe it was the day you got your booster and you were never quite the same afterward. Maybe it was the week you had COVID and swore you recovered, except you never actually felt like yourself again. I am not here to tell you what caused your symptoms, because I cannot diagnose you through a screen and I would never pretend to. What I can tell you is that if that timeline sounds like your own, you have every right to bring it up specifically with a doctor, and you have every right to ask for the specific antibody testing that screens for Sjogren's rather than accepting a normal basic panel as the final word. If this is resonating with you, comment the word pattern below, because I read every single one of these and it genuinely helps me understand what people are actually experiencing versus what gets published in a study. I also want to address something that confuses almost everyone in the early stages of this, which is how to tell the difference between Sjogren's and the other autoimmune conditions it constantly gets confused with, because getting misdiagnosed with the wrong one can delay real treatment for years. Sjogren's versus rheumatoid arthritis. Both cause joint pain and fatigue, and both can run in the same families, which is part of why they get confused. But rheumatoid arthritis primarily attacks the joints themselves, causing visible swelling and eventually joint damage on imaging, while Sjogren's centers on the glands first, with joint pain as a secondary symptom that rarely causes the same structural joint damage over time. If your joint pain moves around without much visible swelling, and dryness came before or alongside it, that pattern leans more toward Sjogren's. Sjogren's versus lupus. These two overlap so heavily that a significant number of Sjogren's patients also carry a lupus diagnosis at the same time. Lupus tends to involve more organ-specific flares, including kidney involvement and a distinctive facial rash, along with more dramatic swings in disease activity. Sjogren's tends to be steadier, with dryness as the constant backbone symptom that lupus does not typically center around. Sjogrens versus multiple sclerosis. This is one of the most dangerous mix-ups, because Sjogrens can directly affect the nervous system, sometimes causing symptoms nearly identical to MS, including numbness, vision changes, and even lesions that can show up on brain imaging. Patients have been misdiagnosed with MS for years before someone finally checked for Sjogren's antibodies. If dryness is present alongside neurological symptoms, that combination should always prompt a Sjogren-specific antibody test before settling on an MS diagnosis alone. Sjogrens versus fibromyalgia. Fatigue and body pain overlap heavily between these two, and fibromyalgia is often the label doctors reach for once basic blood work comes back normal, because fibromyalgia does not require a positive antibody test to diagnose. The problem is that this becomes a convenient explanation that stops the search for antibodies that were simply never ordered. If you have been told you have fibromyalgia but you also have real, measurable dryness in your eyes and mouth, that dryness deserves its own specific investigation rather than being folded into the fibromyalgia label. Sjogren's versus Hashimoto's thyroiditis. These two frequently occur together in the same patient, since having one autoimmune condition raises your risk of developing another. Hashimoto's centers on the thyroid, causing weight changes, cold intolerance, and hair thinning, alongside fatigue. If you have already been diagnosed with Hashimoto's and your fatigue and dryness have never fully resolved even with thyroid medication properly adjusted, that unresolved gap is worth specifically asking about, because it may mean a second autoimmune condition is present underneath the one already being treated. Now let's go deeper into the neurological piece, because this is the part of Sjogren's that gets the least attention and frightens people the most once they learn about it. Sjogren's is traditionally taught as a disease of the eyes and mouth, but the same immune attack that dries out your glands can also target your nervous system directly. When it affects the small nerve fibers in your hands and feet, it causes the burning, tingling, and numbness I mentioned earlier, a condition called small fiber neuropathy, which frequently does not show up on standard nerve conduction studies, meaning patients are told their nerve tests are normal even while they are clearly experiencing nerve symptoms. This is one of the most invalidating experiences a patient can go through, being told the test is normal while your body is telling you something is very wrong. Beyond the peripheral nerves, in a smaller subset of patients, Sjogren's can affect the central nervous system itself, contributing to the brain fog I described, and in rare documented cases, contributing to lesions on brain imaging that can be mistaken for multiple sclerosis, as I just walked through. Researchers believe this happens through chronic low-grade inflammation affecting blood vessels supplying the brain and through direct immune activity within nervous tissue itself, though the exact mechanism is still being actively studied. If any part of this neurological piece is hitting close to home for you, comment the word nerves below, because this is exactly the part of Sjogren's I think gets buried the most in mainstream explanations, and I want to know how many of you have been told your nerve tests were normal while you were still living with these symptoms every day. Let's talk about what an actual path to answers looks like, because I do not want to leave you with only fear and no direction. If you are reading this and recognizing yourself in these signs, here is what a reasonable next step looks like. Start keeping a symptom diary, tracking specifically when dryness happens, when fatigue hits hardest, when joint pain shows up, and whether any of it correlates with time of day or activity. This matters more than people realize because fluctuating symptoms are exactly what gets dismissed without documentation, and a diary turns a vague complaint into a pattern a doctor can actually act on. Ask specifically for what is called an antinuclear antibody test, along with the specific Sjogren's antibodies known as SSA and SSB, sometimes labeled Roe and Lane. These are not part of a routine physical and have to be requested by name. If your primary doctor is hesitant, ask for a referral to a rheumatologist, because rheumatologists are the specialists trained specifically in autoimmune disease and are far more likely to recognize this pattern than a general practitioner seeing it for the first time. There are also simpler tests your doctor's office may not think to order, including a test measuring actual tear production and an exam checking for reduced saliva flow, both of which can support a diagnosis even before more extensive blood work comes back. And if you have had COVID or a COVID vaccine within the time frame your symptoms started, write that timeline down and bring it with you, because that context can change how seriously a doctor investigates further, and it is information they may not think to ask about unless you volunteer it. I also want to spend a moment on the signs that show up outside the classic symptom list, because these are the ones patients tell me repeatedly get waved away as unrelated, when they may actually be part of the exact same picture. Nail changes. Some patients notice their nails becoming more brittle, developing ridges, or splitting more easily than before, which can happen when chronic inflammation affects the small blood vessels feeding the nail bed. On its own this means very little, but paired with dryness and fatigue, it becomes one more data point worth mentioning to a doctor rather than dismissing as a manicure problem. Skin changes beyond dryness. Beyond the itchy, dry skin I mentioned earlier, some patients develop a condition where small blood vessels under the skin become inflamed, producing small reddish or purplish spots, most often on the lower legs. This is worth photographing and showing to a doctor directly, because it is a visible sign that is easy to document and easy for a rheumatologist to recognize immediately. Breast and chest wall discomfort. This one surprises people, but chronic ache or tenderness in the chest wall and breast tissue has been reported by Sjogren's patients, likely connected to the same widespread inflammatory activity affecting connective tissue elsewhere in the body. It is not a classic textbook symptom, which is exactly why it gets missed, but it shows up often enough in patient-reported experience that it deserves mention here. Unusual urine changes. Because Sjogren's can, in a subset of patients, affect kidney function through a condition called interstitial nephritis, some patients notice changes in how often they need to urinate, along with unusual foaminess, which can be an early sign of kidney involvement worth flagging to a doctor rather than assuming it is simply hydration-related. Digestive symptoms that mimic other conditions. Beyond the reflux and bloating already mentioned, some patients develop symptoms that closely resemble irritable bowel syndrome, including alternating constipation and diarrhea, and are treated for years for a digestive condition alone, when the underlying driver is the same systemic immune activity showing up in the gut lining. None of these symptoms on their own point clearly to Sjogren's. That is exactly the problem. Each one looks small enough to ignore individually. It is only when you put 4, 5, or 6 of them together, especially with a timeline that starts after a COVID infection or a vaccination, that the full picture becomes visible, and that full picture is precisely what most doctors, working through a 15-minute appointment focused on one complaint at a time, never get the chance to see. I built something specifically for not just tracking and doctor's appointment. It is called Sjogren's Ultimate Symptom Map and Diagnostic Action Plan, and it walks you through exactly which symptoms to track not just for Sjogren but also for MS and RA. Drop symptom map in the comment, and I would send the link for you to access it. Before we close, I want to go back to the counter-argument a smart, skeptical viewer is probably already thinking. COVID, the virus itself, is a well-documented trigger for new autoimmune disease, so how do we know vaccination specifically is contributing anything at all, rather than it simply being the virus doing what viruses have always done? This is a fair question, and the honest answer is that we do not yet have a large-scale, definitive study that cleanly separates vaccine-triggered cases from infection-triggered cases across a massive population, because both exposures became so widespread around the same time that untangling them is genuinely difficult research to do well. What we do have is a growing collection of documented case reports following vaccination specifically, in patients with no infection history at the time symptoms began, which is enough for researchers to say this deserves serious investigation, without being enough to say vaccination is a common or a proven direct cause. Holding both of those truths at once, that something is worth investigating and that it is not yet proven at scale, is uncomfortable, but it is also the only honest place to stand right now. Whether future research eventually confirms every mechanism I have walked through today or eventually rules some of them out, there is one thing I already believe without any doubt. Patients experiencing unexplained fatigue, dryness, joint pain, and brain fog after COVID or after vaccination deserve to be taken seriously, not dismissed, not told it is only stress, and not sent home with a normal basic panel as the final answer when more specific testing exists and simply was not requested. Science moves forward by investigating uncomfortable questions honestly, not by pretending those questions do not exist, and you asking your doctor for a specific antibody test is not paranoia, it is exactly how earlier diagnosis happens. There is also a question of who is more likely to be affected in the first place, and while research here is still developing, a few patterns keep showing up. Sjogren's disease overwhelmingly affects women, at a ratio of roughly 9:1 compared to men, which lines up with the broader pattern seen across most autoimmune disease. Family history matters as well, since having a close relative with any autoimmune condition, not necessarily Sjogren specifically, raises your own baseline risk, because autoimmune susceptibility tends to run through shared genetic pathways rather than one specific disease being inherited directly. Age plays a role too, with most diagnoses happening between the ages of 30 and 60, though it can appear earlier, and cases in younger adults are exactly the ones most likely to be dismissed since Sjogren's is often thought of as a disease of older women, which delays diagnosis even further in exactly the population that could benefit most from catching it early. And having one autoimmune condition already, whether that is Hashimoto's, celiac disease, or something else entirely, meaningfully raises the odds of developing a second one, which is why doctors should be more vigilant in patients with an existing autoimmune history, even though in practice that additional vigilance often does not happen until a patient specifically asks for it. I think the honest summary of everything we have covered today is this. Something changed for a meaningful number of people after COVID infection and after COVID vaccination, and researchers are actively working to understand exactly what that something is and how large that number actually is. In the meantime, the practical reality for you, watching this video because something has not felt right since your own infection or your own vaccination, is that you do not have to wait for the research to be fully settled before asking for the right tests. You can bring this timeline to your doctor today. You can ask for the specific antibodies by name today. And if a normal basic panel is treated as the final word, you can ask for a referral to a rheumatologist rather than accepting that as the end of the search. If you want to understand what happens when Sjogren's is left undiagnosed for years, including how it eventually starts affecting the brain and nervous system in ways almost nobody warns you about, that is exactly what the next video in this series is going to cover, and I think once you see it, a lot of scattered symptoms you have been quietly living with are going to make a lot more sense. Drop a comment with the word next if you want me to notify you the moment it goes live, and I will see you there.